Hello wonderful students, myself Dr. Maddineni Srinivas, Dermatology faculty from Bharat. So in this video we are going to look at the skin question, systemic sclerosis, which was asked in the MGR University in the medicine paper. So let us begin the discussion with the basics of the systemic sclerosis. So what is the systemic sclerosis? You should remember that it was earlier called as Scleroderma, which simply means thickening of the skin, but because other organs are also going to be affected in this condition, so now the better term which we prefer is systemic sclerosis. So it is an autoimmune connective tissue disease. I hope all of you know connective tissue diseases. So many of them are systemic lupus erythematosus, dermatomyositis, and scleroderma. So TGF beta, transforming growth factor beta, plays an important role in the etiopathogenesis of this condition. And like most of the connective tissue disorders, females are more commonly affected than males. 7:1 is the ratio, and age group is 30 to 50 years. And major organs which are affected, you can name it, and that organ is going to be affected. So we are going to see one by one what are all the organs which are affected. Exact cause is unknown. So most of the conditions, 99% of the conditions, etiology is unknown. In the pathology, you might have read this already. So you can remember few of the triggering environmental factors: silica dust, phenyl chloride. So basically there's going to be activation of the fibroblast, because of which there's going to be fibrosis and the excessive collagen deposition in the skin and also in the organs. There are going to be vascular changes, inflammation can be there, there can be thickening of the intima, because of which narrowing of the blood vessels occurs, and ultimately there is going to be this ischemia of the blood vessels. And there is going to be T lymphocyte infiltration, because of which there is going to be fibrosis and the vascular injury. And of course TGF beta, we have already seen this. And if there is a overlap of different connective tissue disorders, we can have the combinations, like for example sclerodermatomyositis and mixed connective tissue disease. Of course, about the dermatomyositis I have already made a video, you can check it out. So now coming to the important crux of the discussion, which is the variants of the systemic sclerosis. Remember, we have limited variant and we have diffuse variant. The important differentiating factor is skin. So if the thickening of the skin is present proximal to the elbows and the knees, proximal to the elbows and the knees, then we call it as a diffuse type of systemic sclerosis. But if it is only confined to the distal areas of the elbows and the knees, okay, we call them as limited type of systemic sclerosis. This is very important point. So just check out the skin involvement, distal extremities, it is limited. And if it is widespread, and also if the trunk, the more proximal areas, if they are affected, we call it as diffuse variety. This is the most important differentiating feature externally. Okay, there are so many other differences also in the organs and also in the antibodies. We are going to see them one by one, but this table is very important. You can take it a screenshot and you can save it and you can read from this. So here you can see in the severity, obviously the diffuse variety is going to be more severe and prognosis is going to be worse. And antibodies, this is also one more important point. It is anti-centromere antibodies in the limited variety, and it is anti-topoisomerase in the diffuse variety, or it is also called as anti-SL70. And in the organs, remember the most important cause of death in the systemic sclerosis is due to the involvement of the lungs. So in the limited variety, we are going to have the involvement of the lungs with pulmonary artery hypertension. Remember, in the limited variant, the most important part of the pathogenesis is going to be the vasculature. So that is the reason why there is pulmonary artery hypertension, which is more important than the fibrosis of the lung, which is also called as interstitial lung disease. And interstitial lung disease is the most common cause of death in the diffuse systemic sclerosis. And in the GIT, we are going to have this esophageal dysmotility. Esophageal dysmotility will be there. I hope you all know the crust syndrome. Crust Crust stands for calcinosis cutis, C is calcinosis cutis, R is Raynaud's phenomenon, E is esophageal dysmotility, S is sclerodactyly, T is telangiectasia. So this is the crust syndrome in which you are able to see this esophageal dysmotility. Whereas in the diffuse systemic sclerosis, the involvement is going to be of the entire intestine. So intestinal dysmotility will be there, and you can also see small intestinal bacterial overgrowth. Small intestinal bacterial overgrowth. The renal system is also very important, and the involvement is going to be very, very early in the case of the diffuse systemic sclerosis, where we are going to see this scleroderma renal crisis. We call it as scleroderma renal crisis. It is very important in diffuse variety, and it can also be seen in the limited variety, but it is very uncommon. Cardiac involvement, remember, there is going to be restrictive cardiac myopathy in the diffuse variety. Raynaud's phenomenon can be seen in both of them, but it is most often the first symptom in the diffuse variety. Skin changes, there is going to be sclerodactyly, that is, there is going to be thickening of the fingers. We call it as sclerodactyly. And flexion contractures can be seen more common in the diffuse variety. Why? Because there is going to be most important fibrotic changes happening in the diffuse time. And also pigmentation, remember, in the case of the limited, always remember this important point, the problem is going to be in the vasculature more than the fibrotic changes. Whereas in the diffuse variety, fibrosis is very important. So we are going to see the telangiectasias. Telangiectasias is dilated blood vessels in the limited variety of systemic sclerosis, whereas here we are going to see there is going to be hyper and hypopigmentation of the skin. And survival, remember, the survival in the case of the limited variety is very good. More than 70% are going to be alive even after a decade, whereas here it is going to be 40 to 60% at 10 years. So the mortality is going to be high in the diffuse variety because of all the organs involvement and also the possible complications. So you can take a screenshot of this particular frame, and you can revise it. This is very important. After this, you are going to just see what are all the important points in the form of summary. So in the skin, you can see there's going to be Raynaud's phenomenon. What does Raynaud's phenomenon see? If there is exposure to the cold, then in these patients there is going to be initially a vaso constriction. A lot of vasoconstriction is going to happen, because of which the color of the skin will become white. Later on, because of the presence of the deoxygenated blood, there is going to be this bluish discoloration which happens later, and ultimately there is going to be the vasodilatation, because of which the oxygenated blood is going to enter, so it will appear red in color. So this WBR, or you can remember PCR order of the color change of the skin, which is seen in the patients of systemic sclerosis, we call it as Raynaud's phenomenon, and it is due to the vasospasm. PCR is pallor, cyanosis, and rubor. Okay. And we are also going to see in the skin, there is going to be edematous swelling and also erythema before the thickening of the skin. And here there is one interesting observation, that usually the old age are the ones who are going to be affected with systemic sclerosis. And in the old age, what is commonly seen over the face? Wrinkles will be seen. But here what will happen, because of the excessive collagen deposition and also fibrosis, these wrinkles are going to be lost, because of which the skin is going to appear, the face is going to appear very, very young. Okay, despite the patients are going to be 30 to 50 years age group, but they are going to look very younger because of the fibrosis and thickening. So this is what is called as mask-like faces, or this is also called as expressionless face. And also there's going to be difficulty in opening of the mouth, so microstomia will be there. So here you can see there are so many points which are mentioned here, but you can see telangiectasias, that is dilated blood vessels, are going to be seen here, and also microstomia. In the musculoskeletal system, there's going to be, body pains, arthralgia, and also, like I've told you, there can be overlaps. So there can be, myositis also in some patients, and flexion contractures because of the fibrosis. Gastrointestinal system, esophageal dysmotility, GERD, SIBO. Okay. And pulmonary features, very important, pulmonary artery hypertension in the case of the limited variety, interstitial lung disease, pulmonary fibrosis in the case of diffuse variety. Cardiac features, you can remember restrictive cardiac myopathy, and also there can be pericarditis. Arrhythmias can also occur because of the fibrotic changes. Renal, there is going to be renal crisis, so renal failure can happen. Okay. In the neurological, you can remember there can be entrapment neuropathies because of the edema and thickening of the skin. Okay, and in the genital urinary, there can also be erectile dysfunction and difficulty in the sexual activity of the woman, dyspareunia. Now coming to the management, you have diagnosis and also that is the investigation and the treatment. So one mark may be assigned by the examiner. So in the diagnosis, just remember they are going to be autoantibodies. We have already seen that in the table. Anti-centromere antibodies in the limited variety and anti-topoisomerase in the diffuse variety. Of course, ANA also can be positive. And for the lungs, you can do high resolution CT pulmonary function test. Just remember what organs are affected. You can easily write down investigations. So heart, you can do echocardiography and ECG. And in the GI tract, you can do manometry and gastric emptying studies. So what is the most accurate study? It is, of course, in the skin biopsy. Take a small tissue and send it for pathology reporting. And there's going to be this collagen deposition and also this sclerotic changes, that is thickening fibrotic changes happening. So in the management, remember the first line of the treatment is going to be for Raynaud's phenomenon, calcium channel blocker. So this treatment part, just remember based upon the organ system involvement, our treatment is going to be tailored for patients. So calcium channel blockers for Raynaud's phenomenon. And if there is pulmonary artery hypertension, we are going to use the prostacyclin analogs and endothelin antagonist. So these medications, bosentan, epoprostenol, you can remember them. And in the renal crisis, remember ACE inhibitors, enalapril is going to be the most important medication. It is not angiotensin receptor blockers, it is ACE inhibitors which are going to reduce the mortality in the case of renal crisis. And remember one more important point, in the scleroderma, the usage of the steroids is going to cause the renal crisis. So we should avoid using the steroids in the patients of the scleroderma. Now coming to the interstitial lung disease, that is fibrotic changes if they are seen in the lungs. MMF is a good drug, mycophenolate mofetil. Whereas if there is involvement of the GERD and esophageal dysmotility, proton pump inhibitors are going to be used, and also metoclopramide. And if there is SIBO, we can also prescribe the antibiotics. Okay, so these are the important points related to the systemic sclerosis. I hope this video was helpful. Please do hit that like button. Also do share this among your friends who might be getting some advantage in the examinations because of these videos. Okay, so that's it in this video. Happy learning, dear students. Sarvam Sri Krishna Arpanam, Sarve Jana Sukhino Bhavantu. Bye bye.